Hello guys, hope you are doing well. This is Dr. Najibulani Azman. Today we'll be discussing shock in its different type. Let's start from a question. A 76-year-old man is brought to the emergency department by ambulance after being found unconscious in his bathroom. His temperature is 36.0 Celsius, pulse is 142 beat per minute, irregular respirations are 25 per minute, blood pressure is 75 by 40 millimeter mercury. He doesn't open his eyes but does withdraw from painful stimuli. The extremities are cool to touch and capillary refill time is 4 seconds. He is intubated and mechanical ventilation is initiated. Pulmonary artery catheterization shows increased central venous pressure, increased pulmonary capillary wedge pressure, increased systemic vascular resistance. Which of the following is the most likely explanation for these findings? Traumatic hemorrhage would cause hypovolemic shock. Spinal cord injury would cause neurogenic shock. A systemic allergic reaction would cause anaphylactic shock. Massive pulmonary embolism would cause obstructive shock. Acute myocardial infarction, most probably the right option here. Widespread infection would cause septic shock. So it is cardiogenic shock. Now let's discuss it in details. And in hypovolemic shock, and the problem is that there is blood volume loss. It could be caused either by hemorrhagic causes or non-hemorrhagic causes. Hemorrhagic causes like upper GI bleed, trauma, aneurysmal rupture, and non-hemorrhagic causes like diarrhea and burns. So, in this case, due to low blood volume, the cardiac output would be decreased. Also, due to low blood volume, the preload or the PCWP would also be decreased. But as a compensatory mechanism of the heart, the SVR or the systemic resistance would be increased because the body wants to compensate by constricting the systemic blood vessels in order to maintain the main arterial blood pressure. So the SVR would be increased. Cardiogenic shock, it is caused by decreased pumping ability of the heart. In this case, the most important cause is myocardial infarction, but it could also be caused by arrhythmias or cardiac myopathies. So in this case, due to decreased pumping ability of the heart, the cardiac output would be decreased. But as opposed to hypovolemic shock, in cardiogenic shock, the PCWP or the preload would be increased. And the reason behind it is that although due to decrease pumping ability of the heart, the blood count goes forward, but it goes backward and increase the preload, so it increases the PCWP. And again, as a compensatory mechanism, the systemic vessels resistance would be increased. In obstructive shock, the main problem is that there is a physical stress which is preventing the blood to move forward. So in this case, it could be caused by cardiac tamponade, in which case there is decreased diastolic filling because of physical stress. Also, it could be caused by tension pneumothorax, which is leading to decreased venous return, and also it could be caused by massive pulmonary embolism, in which case there is a blockage in the pulmonary artery and it increases the afterload. So in this case, again due to a physical stress, the cardiac output would be decreased, and the preload, if it is caused by massive pulmonary embolism, in this case, as there is blockage in the pulmonary artery, so the blood can't go from right side of the heart to left side of the heart, so the preload would be decreased. But if it is caused by cardiac tamponade or tension pneumothorax, in which case due to a physical stress, the blood, the heart is under pressure, so the blood goes backward and increase the preload. And again, as a compensatory mechanism, the SVR would be increased. And distributive shock. In distributive shock, there are three types of shocks, like septic shock, anaphylactic shock, and neurogenic shock. So in this case, the main problem is that the systemic vessels are dilated too much. Like in septic shock, due to infection, systemic cytokines dilate the systemic blood vessels and pulling the blood in the systemic circulation. In anaphylactic shock, like it could be caused by drug allergies, insect bites, and food allergies, like peanut allergy is the most common cause. In this case, again, histamine is released, which dilate the blood vessels and pulling the blood in the systemic circulation. And in neurogenic shock, there is a problem with sympathetic system, like it could be caused by spinal cord injuries or traumatic brain injuries, in which case the sympathetic nervous system is disturbed and the blood vessels dilates. So in this case, again, the cardiac output would be decreased, especially in neurogenic cause. Neurogenic shock, the cardiac output would be decreased. But in septic and anaphylactic shock, in early stages, the cardiac output would be decreased. Later on, it decompensates and decreases. And the PCWP, it would also be decreased, specifically in neurogenic and anaphylactic shock. But in septic shock, if the patient is resuscitated well in early stages, it would be normal, and later on it decreases. But as opposed to other types of shock like hypovolemic, cardiogenic, and obstructive shock, the systemic resistance would be decreased, because like we mentioned earlier, that systemic cytokines and histamine release and also disturbance in sympathetic nervous system dilates the blood vessels. So therefore there is decreased afterload, and it leads to decrease systemic resistance. Hope guys you have understood it.